it's like 0, maybe +1.
Ah,
Should be normal, it should be minus, but now it's problem with the weather around the world. And now it's more than 0, but normal in this time should be like -5, -10. But now it's
okay.
+1, maybe
Yeah.
0.
But
But
your
still is
face, but never mind.
Welcome to ISWAM Virtual 2021.
Good afternoon, everyone. Welcome back to Virtual ISWAM in 2021. And this afternoon, we will have a special topic. It's about skin problems, finding the right weapons to manage the skin problems. This morning, we have so many topics that is very interesting. Yeah, we have talked about patient safety. We have talked about how to fight COVID-19 in aesthetic field. And then we have two speakers that have discussed about hyperpigmentations. Now, this afternoon, we will talk more further about skin problems. And for these topics, we have invited two beautiful ladies. The first speaker from Poland, that is Dr. Anna Galeba, PhD, MD. And then the second speaker will be from Lebanon, Dr. John Haddad. And now with us, has already joined with us, Dr. Anna Galeba, PhD. Hello, Dr. Galeba, how are you?
Hello. Hello, how are you? I'm fine. Thank you so much for invitation for ISWAM, and good morning, good afternoon. It depends from which kind of country we are. Yes. Because in Poland it's definitely morning.
Yes. Okay. How is it, the weather in Poland? Is it very cold there?
Yes, it's something about zero, but still it's okay because normal should be under zero. In this case, it's not cold, but for sure it's cold.
Okay. But we meet a very beautiful lady, Dr. Anna Galeba, so I feel always warm if I see you. Okay. So this afternoon, Dr. Anna Galeba, yeah, you will talk about premature skin aging, a process that can be stopped by appropriate prevention, including aesthetic medicine treatment. Yes. Okay.
Yes.
Before you start the presentation, I will briefly read your CV first. Yeah, so everybody will know more about Dr. Anna Galeba. Okay, this is your CV. Dr. Anna Galeba, PhD, MD from Poland. Education 2006 to until 2008, Graduate School of Aesthetic Medicine of Polish Medical Society in Warsaw. And then 2007, 2008, Graduate School of Healthcare Management, University of Medical Science in Poznan. And then 2011, PhD in Medicine. And then award for Dr. Anna Galeba. 2017, she was awarded the Diploma in Aesthetic Medicine in Miami, USA. 2016, obtained the title of Certified Aesthetic Medicine Doctor from USA. And in 2006 and up to present, courses in aesthetic medicine all over the world, Poland and more than 100 times, USA, Germany, UK, Brazil, Thailand, South Africa, IUA, Malaysia, India, France, and Italy. Okay, so for Dr.
Yes, and at the beginning, 99 and 2006, medicine, medical doctor, because 7 years in Poland, we are studying medical, to be a medical doctor. Yes, at the beginning.
Yeah, it's an honor to have you here. Okay.
Yes.
So now the time is yours. You can start your presentation.
Okay, thank you so much. Good morning, good afternoon for everybody, and we can start my presentation. Okay, please next slide. Skin aging. Skin aging is divided into proper aging, improper aging. Proper aging, it's a physiological process. It depends on genes. Improper aging, it depends of external factors. Many times we are speaking about this kind of aging, photoaging. Of course, about proper aging, we cannot do nothing because everyone from us is getting old. But we can do a lot about improper aging by a special kind of prevention by our lifestyle. Please, next slide. For example, the most important is how we'll be, what we'll be doing, how we'll be living. For example, do not smoke cigarettes, do not use tanning beds. This is special, very popular inside Europe because we always have dark and people want to look more healthy and we like to be dark. I know that in Asia, people like to be white, but here is really popular. And this is very bad, not only for getting old, but it's very bad for a lot of diseases, even including cancer, but it's a really huge problem and many young girls like doing this. Very important is that during the year we'll be using photoprotection, we'll be doing sports, avoid stress, diet is important with a lot of vegetables, a lot of fruits, without stimulants, with antioxidants like, for example, green tea, like vitamins like ACE, a lot of things which it's really giving our body good things, and because of this we can make the process slow down. And of course with aesthetic medicine treatment, aesthetic and anti-aging aesthetic medicine treatment, we can make that our appearance, our look will be much better, much younger, and this we can really do. Please, next slide. We have a lot of kind of aesthetic medicine treatment. From one kind, for example, we are doing that our skin looks better, looks younger because produce collagen, elastin, hyaluronic acid. Of course, with hyaluronic acid, our skin has a lot of water inside skin. With collagen, elastin, it's more strong. And this kind of treatment which we can do this, it's for example chemical peels, needle mesotherapy, PRP, lasers, but we have different kind of treatment, like for example fillers or botulinum toxin, that we can change the appearance very fast, and we can do that. For example, our look will look much younger and better. Everything is depend from the doctor, everything is depend from the patient, and everything is depend which kind of treatment we'll use for the special kind of patients. Because for me the most important is that we will be doing that if patients will come to us, not the patients will come and say for me I want big lips. No, many times this big lips, it's at the end, because we have to explain why it's important before to rebuild good skin, to do that skin will look healthy, and after this we can do different kinds of treatment, and the combination of these methods is the right way that we really could look attractive, could look young. Please, next slide. The most important is for which kind of doctor the patients will come, because for me the most important is that the doctor can say no for the treatment. And this is never mind, it's plastic surgery, cosmetic surgery, or for example, aesthetic medicine doctor, because cannot be like this, that patients is coming and speaking, for example, I want this, this, and this. Okay, we're listening what the patients wants, but we have to explain what is important for these patients and what these patients have to do. And if it's like this, that like I told before, aesthetic doctor can say no for the treatment, the patients will be not a victim of aesthetic medicine, will look men will look more handsome, women will look more attractive, more young, and this which we'll really like and we want to do with the people. Please, next slide. What is the reason to use aesthetic medicine treatment? Next slide, please. The research was a performance of patients using aesthetic medicine treatment. It were 603 patients, both sexes, aged 21, 61 years old, and using the procedures, only 4 kinds. It were needle mesotherapy, chemical peels, and fillers. Fillers only with cross-linked hyaluronic acid, and botulinum toxin type A injected for a correction of wrinkles, not, for example, hyperhidrosis. Okay, next. Only participants who expressed consent were included in this study. Participation in the survey was voluntary and anonymous. The subjects complete the survey anonymously. They were informed of the purpose of conducting the investigation and that the resulting data would be used for scientific research. Please, next. It's materials and methods which I used inside my researches. I will not speak about this, but if somebody is interesting, can write to me another problem that I will send the information and I will explain more. Please, next. Patients were asked the question, what is the reason to use aesthetic medicine treatment? It were 7 kinds of answer, 1, 2, 3, 4, 5, 6, 7. 1 was the least important, 7 the most important. And for everyone answered patient, even for everyone could answer 1 or answer 7 or answer 6, what really was important for him, for her. And what is the reason to use aesthetic medicine treatment? Because, for example, I wanted to look more attractive, I wanted to look younger, I wanted to gain more self-confidence. I have always been attractive, but over the years my appearance has deteriorated and I wanted fix. It's a requirement of my profession. My appearance is important in my profession. I wanted to become more liberal in relation to the various challenges posed by life and work. I can't accept the fact that I'm getting old and I want to delay the process by using these treatments. I wanted to become more liberal in relation to other people, and I had a lot of complexes associated with my appearance. Why these people, for example, wanted aesthetic medicine treatment? Please, next. The most common reason for the patients who decide to make use of aesthetic medicine treatment is look more attractive. 86% of respondents answer like that. The second reason for 69% look younger. The least important reason, but for me still it's a lot, because 55% for me it's really a lot. It's complex, it's associated with appearance, and be more liberal in relation to other people for 48% of the respondents. I know it's the least important, but for me still it's a lot, because 48% it's a lot of respondents. Please, next. Do you see your present look to be more attractive than before the aesthetic treatment? And what is the most important? 94% of the patients answer yes. Okay, next. Do after aesthetic treatment, the people change attitude to you? the same. A lot of people answer because 41% for me, it's really very big points. 41% of people answer, yes, it's happened. Definitely, the people change attitude to you and in good way. Okay, next. Aesthetic medicine treatment might be good and bad, and this is problem because we see a lot of bad work around the world, and because of this, really many people afraid to even come for aesthetic medicine doctor. Sometimes a cosmetic surgery, but no, it's just really can be good aesthetic medicine doctor. Only you have to find the right person. Why we are always teaching people, because we want so much that people understand, the patients will understand that aesthetic medicine treatment really can be good and people will look better and natural, because for me the most important is the person will look natural after the treatment. Okay. By the way, of course, everybody know Nicole Kidman. Now, Nicole Kidman looks very pretty, but it was the time, and we see even of the two kinds of photos for the left side. Not something not working. Up, it's about the fillers. It's definitely in the bad place, and too much fillers. Why the face looks not good. And down, it's about the Botox, because this kind of face, her looking, it's because of Botox, and cannot be like this, because really when we are looking for this kind of person, we see that something is not working. The good work is when we are looking for the person and we don't know which kind of treatment he had, and just we are thinking why, for example, this person is 40, 50, 60 years old and looking very, very good, not for the age which this kind person has. Okay, next. The same here, of course, everybody knows Mickey Rook, and something definitely not working, but this is not only aesthetic medicine, it's cosmetic surgery. And I don't understand what happened, that because for me it should be that this moment when, for example, patients is coming to me and I am speaking no, because it's dysmorphophobia. And we have to explain why, for example, you cannot push me for the treatment. And many times I have fight inside my cabinet because patients want more and more and more. And many times, for example, 3, 4, 5 years ago, they always were speaking, no, I will never do this. And after 5 years, they are pushing me that I have to do this. But no, I'm always speaking no, because for me the most important it's how you will be looking, not that you will be your victim. The same Lara Flynn Boyle, she's only 47 years old. I know a lot of my patients which has this age and look very good. Her smile, it's definitely not natural. Her face is definitely not natural. Sometimes for me it's better to have more wrinkles but look natural, like have a lot of fillers inside the face without wrinkles, but the person look not good. It's sometimes like dolly, sometimes like different person, sometimes very not natural work. Okay, next. The same Meg Ryan, the smile definitely it's not natural. Too many fillers inside the face. No, this is not good work. Tina Turner now looks better, but it was 2 years ago. No, the same. Too many fillers inside the face, and the face even smiling, even looking, it's definitely not natural. Okay, next. No, Goldie Hawn, everybody know Goldie Hawn, the same. What is this kind of smile? This is not normal smile. Many times the patients wants, because has wrinkles around the lips, and wants that this wrinkles will disappear. Okay, you can do this, but you have to do this in a right way, that even after the treatment, the person will look natural, but not like this, that person is smiling, and the smile, it's not smile. And I really feel sorry for something like this. Okay, next. And good way. Only few people around the world speaking, okay, I'm using aesthetic medicine treatment. Okay, I'm going for cosmetic surgery. One of this is Cindy Crawford. She always speaking that when she finished 29 years old, she started to use fillers, botulinum toxin, mesotherapy. And even if you are comparing 29, 45, it's the same person. Of course, she's getting old and she looks a little different, but we know that this is she. The same Kate Middleton, for example, disappear her wrinkles around the crossfit, around the eyes, and the face, it's more slimmer. Of course, she changed the nose, but never mind. I love so much good work about cosmetic surgery, and for me, the best way that the person will look very good, it's cooperate plastic surgery, cosmetic surgery with aesthetic medicine doctor. Okay, next. Adele, of course, Adele now looks different because it was before when she lost weight. But even at the beginning, you saw how her face already changed. Sometimes it's hair, sometimes it's good makeup, but we see that really this face, it's totally different, and we can change a lot of things inside the face. That really this face will look better. Because for me, the most important is when patients comes to me, that we have to look for the person holistic, not only for one place. We have to think how to change everything. Many times it's like this, the person, for example, is caring only about the face. Our hands are very old. And from the hands, you know that the person is older than how face looks, and why we have to care about all party of the body, not all parts of the body, not only face, about neck, about hands, etc. A lot of people afraid to do lips, but believe me, our lips can look very natural and very good after the treatment, like you see on the down on the photo. Everything depends which kind of method you will use and how you will make the treatment for the person. The same Jennifer Aniston. For the left side, she's 28 years old. For the right side, she's 48 years old. I don't see a huge gap between these photos, and this is for me right way for this kind of medicine. Okay, next. Mesotherapy before and after. I love mesotherapy and I believe in this so much. And my photos are without Photoshop. Of course, you have to wait months for the result. But after this, when you have result, you have result for many months. This is not like this that will disappear next 2 weeks. For example, left photo, I used Seker 532. It was only 1.5 milliliters. And it was 3 treatments every month, 1 treatment, sometimes 3 weeks. And photo gap between up and down, it's 4 months and 2 weeks. For the right photo, it's 3 months and 4 treatments. But I use different kind of ampoules because Dermal and the same Cytocare 532. And definitely you see that the skin looks better, less wrinkles, and the person looks younger. Okay, next, please. Left side is my friend, my good friend. It was a surprise for me because when she came to me, I told her, you need laser. But she came to me, it was a gap between the work. It's like lunch time, and she came, please do something for me. And I told you need laser, but she didn't have a time for laser. Why I did only 1 mesotherapy? And believe me, it was a surprise for me that after one mesotherapy, it's very good effect. The skin looks much younger. It even changed the color. But between up and down, we wait 2 months because for sure to produce collagen, elastin, hyaluronic acid, we need the time. It's minimum 28 days. But after 28 days, we just start to produce this. The same right side, it was only one treatment. It was Restylane Skin Buster Vital Light. And this result, it's for between 4 and 8 months, but many times 5-6 months. And this is normal. And sometimes if somebody is lucky, has for a longer time. I have many patients and the result, it's even 10, 11 and 12 months. But typical, like for example, I don't know, 60-70%, it's for 6 months. Okay, next. Hands, this which I told before, that many patients only caring about the face, and the hands, it's very bad. Of course, we can do hands by fillers, but this I by mesotherapy. Left photo is only one mesotherapy, but gap it's 2 months between up and down photo. And what I love, the most nice is even the changing the color of the skin, because we start to have new skin, looks much younger, much better. Right side, it's with Restylane Buster Vital. But it was one Restylane per one hand. And this result, it's for 6-7 months. And it's natural, because after this we start to produce collagen, elastin, etc., etc. It's not like only filler. Of course, in the fillers, after the fillers, we produce 2 collagen and elastin and hyaluronic acid, but only few. When we are using laser, when we are using PRP or mesotherapy, this produce it's much more collagen and elastin will have. Okay, next. Medical pills before and after. First treatment, it was TCA, and after 1 month, still you see down a few hyperpigmentation, and this few hyperpigmentation, I did glycolic pill 50%, and after this everything disappear. And for a lot of women, it's big problem, because even makeup cannot hide this, why they feel not self-confident, how the face looks, and they want so much. Don't have this. Okay, next. Fraxel, laser Fraxel dual, and special. I choose the photos, and when I want to show how the skin changed after only one treatment. And everybody from us know that we never are doing one treatment. Many times it's 2-3 treatments. But here, look how is the very good result after one treatment, and between photo up and down, always is 2 months gap. Less wrinkles, much better looks of the skin, much younger, and even the scars are a little more less deep. But of course, this patient, right patients came to me again. But especially I show how it's big different after only one treatment. Okay, next, please. This is very big problem, because a lot of patients are coming, and they are thinking that, for example, good time for start aesthetic medicine, it's 40, 45, 50 years old. No, I'm so sorry, it's too late. Of course, we can handle this, and we can help this kind of person, but the best time, it's the time when the wrinkles start to work, we start to see. Sometimes it's 27, sometimes 29, sometimes 30 years old. And at the beginning, It's not that we are doing a lot of treatments. No, it's just, for example, one filler per 18 months, sometimes 2 years, because this person doesn't need a lot of filler, a lot of mesotherapy. It's just time to time one treatment, just that we will do that. For example, this person will never have permanent wrinkles, because when we start to have permanent furrows and wrinkles, okay, we can handle this, and this is not a problem. But the person have to use more treatments, it's more money and more pain. In this case, for what? Better to protect and all time look good. Okay, next. Botox. I don't know how it's in Asia, but in my country, a lot of people are afraid really Botox, because everything what you see wrong, people speaking, it's Botox. Of course, many times it's fillers, but for them, everything is Botox. Botox is inside lips, Botox is inside, I don't know, nasolabial folds. We still have to educate it. I'm so sorry, it's not Botox, it's filler. Bad word of filler. And here you really see how disappear crossfit, and I think it's the person looks much younger. Even the research is showing us that 5 years younger person looks after the Botox treatment. Okay, next. This is making slimmer face, but left side, it's really only making slimmer face, but right side, somebody with the bruxism. Bruxism, of course, it's a diseases. But left side person, she was on lips. I didn't do. I don't like these lips, but she came to me because of lips, because she didn't like to, and she wanted I will be her patient. But she came. She's only very young. She's only 22 years old, and she came because she wanted to that her face will be much slimmer. And really, after one treatment, you see how it's a good result. But for this result, we are waiting 2, 3, sometimes 4 weeks, typical 3 weeks. And the result is for 6, 7 months. For the right side, it's not only that we are making slimmer face, because this is not about this inside bruxism, because it's very dangerous for the teeth. Sometimes it's a lot of headache, and why we are treating the person. But after this, her face, it's more slim, and the patients love it. Okay, next. For example, right photo, up and down, the person, the muscles are not working. And look how many wrinkles we see up and no wrinkles down. And this I like after the treatment, because the wrinkles disappearing. Okay, next slide. The left person is my favorite person. Why? Because when she came to me first time, she told me, no, I hate Botox. Botox is very bad. I don't want Botox. But she came with a friend. For friend, I did a lot of treatments, and for her only one filler. And after 1 month, she came to me again, because she saw her friends, that friends looks much better than she, and she wanted the same. And now she loved Botox, because she understood that after Botox, we look very natural if it's good Botox. And I love this, how many holes disappearing. And last time she came to me on February, and after this she afraid to come to me because of COVID, etc., etc. And she came to me again 9 or 10 months, I think it was October, and really this holes still didn't come. Why? It's really for very long time the result. The same man. Between up and down, it's almost 6 weeks gap, and way up it's wide, down it's more dark, because it was summer and he wanted to be more dark. But you see the same, how many wrinkles we see up and no wrinkles down. Okay, next. This I love it. This person which came to me first time, she told me, I want only lips. And I told her, you don't need lips. Your lips, of course, it's a little asymmetric, but it's big. But you need different areas. You need zygomatic area. You need chin, cheek, nasolabial folds, etc., etc. And you see how it's really the difference between left and right side. And it was not a lot of treatment. She used only 3 fillers, and it was Botox, and she was very happy that she looks very natural, very pretty. And of course, I did at the end for her lips. Only I wanted it will disappear asymmetric. Okay, next. And the same, it's after and before, and even the right photo, we see that everything it's during the same session, and we see how really the face changing, and how look no much younger and much pretty. The same left woman, she's 52 years old. The face here left photo is even immediately after the treatment, after second treatment, immediately after second treatment. Why we see a little erythema, and she was very happy that really her face looks much younger, and even forehead, the wrinkles on the forehead disappear. Okay, next. Men, believe me, men, my patients too, not only women, but men many times shy, and they like to come that nobody will see that they are coming, and they are using different kind of treatment, only this which is fast, like fillers, like Botox. Left photo, you see exactly how is big gap between before and after. The right side is old man, because he was 72 years old, and he needs more treatment, but he didn't want, because he told me, no, I will look too good, and I don't want that people will know that I am using. I want to look good, but not perfect. And this is immediately after the treatment why still you see erythema and injection sites. Okay, next. This is my one of favorite photos, because you see that it's a very handsome man, but he needs treatment for a bruxism. First, face, it's now more slimmer. Second, he didn't have headache after the because when he has bruxism, he had a lot of headaches and problems with the teeth. And I used 2 fillers for his nasolabial folds, and now he looks much gentle. He still it's very handsome and very manly, but gentle. This face, it's really much better. Okay, next. Lips, I love to do lips, and believe me, you can look very natural, nobody will know, but that you did this kind of treatment. But the most important is who is doing this, how is doing this. And for me, I love that the lips will be more a little bigger, without asymmetry, and much pretty. And even we can do this for old person, because this up photo, this person was before 60, and her lips after the treatment is just looks better with asymmetrics, a little more bigger, and natural. Okay, next. And this is the woman which I changed for her lips, and not only lips, face too. And really, you see how it's pretty and how it's natural. Okay, next. The same, sometimes you even have very big lips, but still looks natural. And many times people will think it's her lips or somebody did for it. This is the best job, that we don't see what the doctor did, only we start to thinking why this person looks better, something he did, or just she it's natural. Okay, next. With this person, I always fighting, because she always want bigger and bigger lips. It was at the beginning, her lips were very slim. For this changing, I need almost 1 year. because it's not like this that you are doing this during one session, because if you will do during one session, it will be not natural, and lips will look very bad. You are giving a filler, you are waiting, for example, 2 or sometimes 3 months, and after this again you are adding and adding, that the lips will be bigger. For me, this lips is a little big, but many patients speaking that no, it's very pretty. Still, I am accepting, but many times we are fighting because she all time want more and more and more. But it's okay. I still accepting, because still it's big lips, but still looks natural. Okay, next. And a good way, it's my patients, 54 years old, really looks natural and very pretty, and I think that nobody will say that it's 54 years old. The same, the right lady, 43 years old, looks very natural and very pretty, and I did for her lips, cheek, nasolabial folds, Botox, a lot of things, and this is the most important, that person after the treatment will look natural. Okay, next. 49 years old. Left photo is even without any way makeup, and no, very natural and really a pretty person. Okay, next. The same here. Right photo is even without any makeup, and left person is 50 years old. Right person is 49 years old. I don't think so that somebody will say that this is 50 and 49 years old. Okay, next. She's my favorite patient. She's 78 years old, and she loves so much to care about herself. And I think that she doesn't look for her age, and even somebody can have almost 80 years old and can look very good. Of course, we cannot do a lot of things because person will look not natural. The most important that person will be much pretty and looks younger, but even a lot of people doesn't think that she's using aesthetic medicine treatment. Okay, next. The same here, left and right person, they are even without any makeup. And the same, natural and very pretty women. Okay, next. Conclusion, 94% of the patients saw improvement in their appearance after aesthetic medicine treatment. The most common reason for patients who decide to do aesthetic medicine treatment is to look more attractive. 86% of patients answered like this. For 69% of respondents is the most important is to look younger. The least important reason, but still a lot, because 55% were complexes associated with appearance, and 48% of respondents be more liberal in relation to other people. 41% of patients notice improvement in ambient attitude to yourself after the benefit from the aesthetic medicine treatment. Okay, next. People, never mind. Women, men want to look attractive, healthy, and young. Many times it's not because they are coming for cosmetic surgery or aesthetic medicine doctor. Many times it's like this, that, for example, somebody choosing good clothes. For example, I'm speaking now about men. After the shaving, using good creams, etc., the face will look better, younger. Sometimes person will tell me, no, it's not important for me. I don't think so. Even it's not important because it's not coming for the cabinet, doing a lot of things which really doing even 2,000-3,000 years ago. We see that inside Egypt, people used medical pills and a lot of things, because all life it was like this, that people caring about looking. Everybody can slow down the aging process of the skin by correct prevention, why people doing sport, caring about diet, etc. And aesthetic treatment is one of the way to prevention the premature skin aging process, but very important which kind of doctor will be with us, because we can be victim of aesthetic medicine, or we can be a person who looks much younger, much pretty, much handsome. And the most important, that people will never think that somebody is using aesthetic medicine treatment, just will think why, for example, he is, I don't know, 55 years old and look very young, very handsome. She's 50, 60 and cannot look like this. And this is very important, and this is good way that person will look younger and natural all time. Okay, next. Thank you so much for your attention. I hope so that you like my speech and it was interesting for you.
Okay, thank you very much, Dr. Galeba. What a nice presentation of your patients. The before after treatment is incredible. Very nice. So to everybody, to all doctors who wants to give questions to Dr. Galeba, please write down your questions in the question box, and I will read it, and then Dr. Galeba will discuss about this. Okay. While we're waiting for the wait. Oh, we have the question here. Okay, say I will read. Wait. Tiffany. Okay, this one is from Dr. Tiffany. If you do combination therapy, how you do treatment plan for aging skin? Yeah, Dr. Galeba, please explain for combination therapy for aging.
Yes, always if somebody coming to me have to speak with me, and sometimes it's a problem because sometimes I don't know how it's abroad, but in Poland many times patients coming and speaking, I want this and I'm listening because this is very important, what is important for the patients, but I always explaining how everything is working, why this person have to start to have like laser, like mesotherapy, like PRP, like for example botulinum toxin and filler, and I'm giving like a recipe. I'm writing everything what we have to do during, for example, because at the beginning it's very hard time because the patients have to use a lot of treatment. After this, it's not like this. Really can come to us only 2 times per year. Why I have a lot of patients from abroad, but the most hard time it's at the beginning. Many money and many treatment, but you can write what is important, how patients have to start, and you are writing when the patient can come. For example, first treatment is now, second is after 6 weeks, second is after 2 weeks, second is after 2 months. We can do like plan for this person, and everything it depends, because sometimes the person has very bad skin and we have to start to work with the skin, or sometimes the person has a lot of holes and a lot of wrinkles, a lot of furrows, and we have to handle this. But normal, you should start with the treatment when we are producing collagen, elastin, and hyaluronic acid. But believe me, it's not working. And at the beginning, 15 years ago, when I was young, I lost many patients because they teach it me like this, and this is wrong. I know that this is right way, but not for the patients, because the patients always after the treatment look bad. A lot of erythema, a lot of injection suits, and always looking bad, and nothing changing, because waiting 2-3 months that something will see. Why? At the beginning I'm doing botulinum toxin and I'm doing fillers, because person will change after, for example, 2-3 weeks. It's very happy because see very big change, and after this I start to work with the skin, because cannot be like this all time is only Botox, all time is only fillers, because it's not working. Have to be okay this at the beginning, because in fast time will change the person, but after this we have to support the skin, because we need everything from inside. Our fibroblasts have to produce collagen, elastin, hyaluronic acid to looks better. The skin will look better, and this is very important. And I understand that a lot of people studying that fears it's caring about the skin. Second are fillers and botulinum toxin, but in the clinic it's not working because a person will be very disappointed. Oh my God, I'm going 3 months and I don't see nothing. Because person it's looking for himself, herself inside the mirror every day, and you will never see this different during all this time. You will see when I will show photo 3 months ago and photo now. But after filler, after botulinum toxin, the person will see huge difference. Why this is important?
Okay.
Like this, you are starting, and later you are doing all of things. And it depends what the person will need, because sometimes it's eyes, sometimes it's neck, sometimes it's hands, sometimes it's nasolabial folds. It depends what the person needs.
Yep. There's also a question from the doctor. If you do combination therapy, how do you make schedule for your patients? Do the patients have to come every 2 weeks or every month? Is it enough?
It depends. It depends from the patients, because not everybody has a lot of money, because this is expensive. This is not cheap. If somebody can come very fast to me, I'm always speaking, I can do you during, for example, 2 months full, and really will be huge difference between before and after 2 months. But it's many treatment at the beginning, because believe me, 1 year later will be not like this. It's only will be only treatment time to time, but this beginning is the most hard for money, for time, for pain, for a lot of things, because I know we are using anesthesia, but this anesthesia, it's working, but not so good, and still patients feel few pain. And for me, I'm always writing that, for example, do this now. If you can come to me after 6 months, it will be great. But if you will come to me after 2-3 months, it's okay. Just you will look perfect, not now. That you can look perfect, for example, after 2 months, but you will look perfect after 6-7 months. This is not a mistake. This is not wrong work from us. It's just that patients needs time to change. Yes, and you can really give the time for the patient. Of course, with mesotherapy, it's better when we can do every 2-3 weeks. But sometimes no, patients doesn't want, because, for example, has very important meeting in the work and cannot look bad. It's a lot of problems about this, but still will be not a problem that, for example, okay, should come after 2-3 weeks, but came after 5 weeks. It's okay. Just the result will be after not, for example, 2 months, is only 3 or 4 months.
Okay, now there's a questions about mesotherapy. Yeah, may I know what kind of mesotherapy do you use? Because you give your presentation about mesotherapy you're doing on the eye area, and then on the neck, and also at the hands area. Could you please explain what kind of active ingredients you use?
Yes.
And then maybe the technique
I
do you
don't.
use? Okay.
Okay, I don't know, do you have this kind of ampoules inside Indonesia, but for sure inside Gulf country I found this. For example, when it's eyelid, I love so much Seker 532, but only like 1 milliliter of this, sometimes 1 milliliter and a half. Sometimes I am a combination this Seker with stretch care, but stretch care always have to be small, because you will have sometimes allergy from this, sometimes erythema for 2-3 days, and sometimes patient doesn't want. It's very good result, but patients need the time to for recovery, and you have to tell these patients you have this time or you don't have this time, because if you will not tell this, patients can be very angry because, for example, has work and have to look much pretty. And for the neck, for the hands, and it depends how the hands look, because, for example, if you have a lot of veins, you need fillers, or you need Restylane Vital skin buster Vital.
Okay.
But if it's only wrinkles, I love so much Seker 532, and it's one ampoule for both our hands, or Dermahil HSR. I don't know, you have this in your country or not. In Gulf country, I found this, that like in Dubai, in Qatar, in Kuwait, the people are really working on this, and I found that it's not a problem, but I don't know it's in Asia or not, and really working. I'm just working by needle and by syringe. I'm doing this very fast, and I don't like, for example, gun. I think it's the name of gun. I don't like. I'm working just by hand, maybe because it's old school, because I'm working 15 years, and we started like this. And really result, it's amazing. It's just a few minutes, because hands I'm doing, I don't know, 8 minutes. It depends from the patient. He can handle this or not. If she cannot handle this, I'm doing 15 minutes. But if it's okay and it's not a problem with the that it's not so good for the patient. Of course, we are doing anesthesia, but still it's a lot of injection, because for hand, I think it's like 400 injection for both hand.
Okay. Okay, thank you very much. It seems that there's no more questions in the question box. We have lots of discussion and explanation from you, Dr. Galeba. It's very nice presentation, and we have discussed many techniques in aesthetic medicine that you have done and you have shared to us. We would like to say thank you very much for your nice sharing and presentation. It really helps all the participants, doctors, to know more about what should we do, what should we choose the right weapons to manage this premature aging for our patients. Okay, I think this is the end for session for Dr. Anna Galeba. Maybe for the closing, you have something to give, take message for the doctors? Please, Dr. Galeba.
Please repeat.
You could give some conclusion for the participants.
Conclusion?
Yes.
Please, if patients coming to you and want something, and you see that this is not good for the patient, don't be afraid that you will lose patients. Explain. Believe me, if you will explain, and the patients will understand why, that I need more, for example, fillers for lips, more fillers for the zygomatic area, or the next cosmetic surgery. Explain, and the patients will love you more, because will trust you that really you care about these patients. And this is very important, that the patients will be not the victim of aesthetic medicine, only will look handsome and will look much pretty and younger.
Okay, thank you. Once again, thank you very much, Dr. Anna Galeba. So this is the end of the sessions. I hope you success always and stay healthy, stay safe in your practice.
Thank you so much. My big pleasure that I could speak for you for ISWAM. Thank you.
Okay, thanks a lot. Yeah. So everybody, thank you. This is the end of Dr. Anna Galeba session. But don't go anywhere. After this, we will continue with our next speaker. Bye-bye, Dr. Anna Galeba. Thanks.
Bye-bye.
Yeah.
Bye-bye.
Thank you. Hello, everybody. Okay, we're still in the second session of Virtual ISWAM 2021, and this afternoon session, we still discuss about skin problems and finding the right weapons. The second speaker for this topic will be Dr. John Haddad. This is a beautiful lady from Lebanon, yeah, and she will present about skin tissues regeneration with growth factors induced therapy for scar treatment. Okay, Dr. John Haddad is here. Let's greeting her. Hello, Dr. John Haddad. How are you?
Hello, how are you? How is
I'm
everything with you all?
fine. Yes, we're fine. Thank you here. Miss you so much, Dr. John Haddad.
Dr. Santi, I don't know what to tell you. Thank you so much. I miss you all.
Okay.
Thanks to all the organizers and everyone watching me. Thank you for having me again 3 times in a row. Thank you very, very much. And I hope Corona ends and everything is over
Yes,
and I come visit
sure,
you.
sure. We
I
pray
really
that
miss
pandemic
meeting
will
with you.
end and next time we'll meet offline, okay? And you come to
Yeah, we
Indonesia.
should go and have a
Okay.
beef satay together.
Okay. Okay, Dr. John Haddad. So before you start the presentation, I will briefly read your CV first. Dr. John Haddad from Lebanon, her profile, she's a doctor in aesthetic medicine and laser surgery, and then 11 years of experience in the aesthetic field, specialized in skin restoration and anti-aging and skin rejuvenation. She worked and trained in Nigeria, Lebanon, Egypt, India, UAE, Kuwait, Germany, Italy, and USA. Excellent knowledge in aesthetic skin types. She teaches about skin health, injectables, and how to restore skin health with minimum resources. Education, 2006 bachelor degrees in medicine and surgery, U.S. Training University for Science and Technology in Cairo, Egypt. 2007, 2006 residency program in Shams University in Cairo, Egypt. Okay, so now it's time for Dr. John Haddad to present your presentation. Okay, take your time.
Thank you very much, everyone. Thank you for having me here again. And today I'm going to talk about the skin tissue regeneration using growth factors and how it is used, or we can use it in treatment of scars and other problems that we encounter in our clinic. Like I always say, like I usually say, that I am not here to tell you what to do. I am here to give you another option if whatever you usually do in your practice is not giving you the results that you want, it's time to get out of the box and go further to look for another solution because our job as doctors is not just aesthetics, it is science. So we need to always keep in mind that beauty is also in our knowledge and teaching our patients that there is always another option. We just sometimes have to go out of the box. So please, if we can move to the next slide. Thank
Excuse me,
you.
Dr. John Haddad, maybe your mic rather uh, your volume of the mic, yeah, so everybody will hear it clearly.
The volume?
Okay,
Yes, okay.
okay.
So what is growth factors? Let me start again. It's been over 10 years we have been talking about stem cells and growth factors, and I do not want to go so deep into differentiation between stem cells and growth factors. I want to explain simply what growth factor is. Growth factors are messengers. Our body, messengers, our body has receptors. We are born with receptors. These receptors, we call their function is to communicate. For example, to make it easy, internet and Zoom. Growth factors is the internet. The receptors is Zoom. So without growth factors, which is the internet, we cannot communicate. So the job of the growth factor are messengers that they are messengers, and the receptors are what gives the action to move and to communicate. So we cannot communicate without receptors, and we cannot even start without growth factors. So growth factors are messengers, and we have receptors in us. Some receptors' job in the skin is to have fibroblasts. Some receptors in other places' job is to do other things. So this is just to simplify. Before I go back to the next slide, please. What are growth factors involved in cellular proliferation? Now, what is the difference between the word proliferation, renewal, differentiation? I will explain this. Cell division means, what does it mean when it divides? It multiplies. What does it mean when a cell starts to divide and multiply? It is renewing the area. So if we've got a wound, we want it to renew. So it has the cells, the tissues have to multiply to have renewal. Renewal means there's also recycling, means the cells will multiply, take some and recycle other things. That means throw away the things that we don't need, means it regulates. So when people talk about, will it cause cancer because it continuously multiply? No. Why is that so? Because of the word regulate. So it means it doesn't work haphazardly. So you cannot keep jogging till you faint. You will get to a point where you have to rest. Why? Because it is specific. Growth factors have messengers, which have receptors that tells them specifically when to start and when to stop. And so in the skin, we are talking about elastin. We are talking about angiogenesis, which also means tissue renewal. So this is another point. So I move to the next slide. Okay, the next slide is okay. So before I talk again about inflammatory phase, proliferative phase, and the last phase, yes, you have to press okay, remodeling phase. Let me talk about the difference between proliferation and differentiation. Proliferate means increase in number. Differentiate means does the job. So the skin is told to do a function, meaning proliferate is to increase in number. Differentiation means to change its function. So we have to understand, so we don't confuse proliferation. Differentiation means it's going to change to cancer cells. No, no, no. Proliferation means increase in number for wound healing. Differentiation means it changes its job, which is the job of the receptors. I hope you're able to link everything together. So the job is told in the skin, we need fibroblasts. The two most important things in healing is blood supply and fibroblasts. So now we talk about inflammatory phase. When we are talking about any disease in the body, inflammation is the cause of aging, of the skin, of heart disease, of everything. Cancer is due to inflammation. So if we can control inflammation, we can definitely control a lot of things. So inflammation is the most important thing to control in everything. Even now with the COVID, everybody's thinking of how to control inflammation and fever and. So it's the same thing. Inflammatory phase takes 4 to 6 days. We have to keep that in mind. Proliferative phase is 4 to 14 days. Remodeling phase is 14 days to 1 year. What does that mean in practical life? When a place is inflamed and we have treated it, we leave it alone. We give it time to heal, 4 to 14 days. We don't do things in the middle of the proliferative phase, or else it can get worse. So it gets more than one signal, and that's not, we confuse the place, so we don't want to do that. So if we are done laser, we will not go back after 4 days and repeat another laser treatment. No, we will wait. And we give time. We don't give false promises. We don't say that I'm going to put something and it's magically going to disappear. If it is skin, it needs to renew itself every 3 to 6 months. If it's eyelashes, it needs 90 days. So we need to address everything scientifically. When people come up and say, no, in 6-7 days you become okay, that is not true. This is marketing, and we are not going to accept to sell things like that. You want to cover something, just buy makeup. So next slide, please. Okay, so this is just an example to explain that when we have inflammation, the first picture up, when we have done a dermapen or microneedling, an example of the inflammatory phase. The proliferative phase, which is a few days later, where the face is still red. This is a phase where we do not do anything, we just care for the area. The remodeling phase is the phase which comes later on to show that with time, the skin will heal and everything will be back to the results that we want. So we don't promise something and say now the results is going to be within 2-3 days. We give everything time. So the next slide, please. Okay, and before all this, we must start at the cellular function. Now that we have understood a little bit the meaning of growth factors, which are messengers, and that our body, our DNA has receptors that tell the messengers what to do, we will have to move to the next thing, which is the skin. If our problem is in the skin, or if our problem is wherever, we look at the skin, check the cellular part. So it is in the next slide, please. Okay. Now, when we have the skin in front of us, we know where the epidermis is, the papillary dermis, the intermediate reticular dermis, and we have a skin problem. For example, we have a scar. We have a scar which is very deep. We need to address first and know where is the depth. Is it in the papillary dermis? Is it in the intermediate reticular dermis? Is it in the upper reticular dermis? Where is it exactly? And then we address, and then we make a plan and tell the patient what are the things that we need. Now, if we have a very deep scar that reaches the reticular dermis, a dermapen is not going to be enough because our skin renews itself every 6 months. So how many 6 months do you need to be able to resurface and get to what you want? You need 10 years maybe. So you need to know when you need, for example, a CO2 device, Q-switch NDI. You need to know when you can combine this with this. So where does AQ fall or growth factors fall? In this situation, when you have a deep scar and you need to resurface and stimulate collagen and elastin, you need to think, what will I gain from growth factors? I'm going to gain safety in renewal, division of the skin, multiplication, healing, inflammation. So I will like this work in a combination with two. The laser resurfacing is going to help with this, and the growth factor is going to help with renewal of healthy cells and regulation of the cellular function. So like this, you're working with two strong forces. So this is a point where we need to combine. But if we've got superficial scars, like acne scars, something that is in the papillary dermis or in the epidermis, you can use the combination of chemical peels and the derma stamp or whatever Devour-Derma roll with growth factors, because your scars are not very deep. So we need to choose our cases according to the depth of our problem. So if we've got very deep scars, we think about laser. And if we're talking about more superficial problems that doesn't need that much of a resurfacing, we can use chemical peels together with growth factors. So identifying where our problem is the base. So we know as our disease is here and we're going to treat as such. So the next slide, please. Now, we've got acne. We've got an area which has scars in the face, for example, and we've got acne. We have to treat the problem first before we treat the scars. So we treat the problem before we treat the outcome. So if I've got acne, I'm not going to go treat the scars because it might get worse. So I'm not going to do, with my experience in complex skin types, I live in the Middle East and in Africa, and we have very complex skin types, just like in Asia, just like in Indonesia, just like in India. So if we've got inflammation and ongoing inflammation, we have to treat it first. Treat it with growth factors that help decrease inflammation, but growth factors do not cure acne. Why is that? In my opinion, over 80 years ago or 100 years, I don't know exactly how many years, they came up with 3 receptors. I think he's Professor Cohen, who took a Nobel Prize. Now we have over 117 types of growth factors, meaning these are messengers with receptors that go and do specific things. We have not yet, in my opinion, found a growth factor that will go and work on the oil glands to make the oil glands shrink. So we have to use the traditional treatment which we have, which would be tretinoin, retinol, whatever it is, salicylic acid, to treat the problem. So we treat what we have with the traditional medications that we have, and then we use what we have now, which is growth factors that control inflammation and help with renewal, to help suppress the inflammation, the redness, which can increase the risk of having more scars and more pigmentation. So we control with growth factors, with AQ, and we treat with our traditional medication. So my main aim here today is to explain that we need to start thinking of combining things together. No more growth factor is alone or chemical peels or laser is alone. It's not like that anymore. We cannot hang our problems all on one device. We have to combine, even for work, even as a clinic or as a center, even if you're talking financially, it's better to keep everything moving together. So we move to the next slide. Pigmentation, whether it is melasma, whether it is due to a burn or a scarring from whatever, we need to know. So we go back to the picture, the old one of the slides, 2 pictures backwards, the depth. If it is very deep, we need to know that we have to use a combination of treatments. Growth factor with melasma is very, very important, because the cause of this pigmentation is, we know the melanocytes are overproducing color in areas more than others. It might be, if it's melasma, due to hormones, hereditary, and etc., things that we cannot control. What can we do to help this lady that doesn't have that has downtime, that cannot do a lot of treatments, cannot afford a lot of things? We give anti-inflammatories. Anti-inflammatories are the cause of the cells to hyperpigment. If we give cortisone, we will have a big problem. We will suppress something, and we'll have another problem with something else like telangiectasia. So what's the best thing to do is to use a safe anti-inflammatory, something that regulates the cellular function, which is deep, which is what she needs to regulate her melanocytes. So we will give, or we will do the derma pen or chemical peel or whatever. I don't like doing lasers with melasma, and use with it growth factors. So we can move to the next slide. Hypopigmentation. Hypopigmentation, or any crisis that we have when treating scars, when treating pigments problem, is very common. Now it's fashion, or let's not say fashion, but it's more common. We are doing, or I'm doing in my clinic, a lot of fat injection. Fat injection, as we know, fat, adipose tissue, contains growth factors, contains also receptors, and also it works in rejuvenating, and it's growth factor, but it is not specific. I don't want to explain so much in that now, that I will do that in the next slides. But what happens when we are treating a person, for example, with burns or with acne, or with, if we use the adipose, the fat that we take from our body, adipose fat, we do nano fat, which is emulsified fat, and we apply it to an area after doing Q-switch Nd:YAG. And then we do the same thing with something, a growth factor like AQ, which has modulators, regulators, receptors that tell them specifically to do wound healing. If I use fat, okay, it's a lot, it's cheaper, it's good, everything, but it's not specific. It means it can go there, it may treat, it may not, because it doesn't have a messenger telling it exactly what to do. But when you have a product that has regulators, that is FDA approved, that you've got studies, and the latest one, which was like in July, I have the studies showing you that you can get a result with something specific. You send someone to go and buy something from the supermarket, the person will buy. But if you send randomly, go and get for me, so it's about specifying. If I've got a patient and I do for her Q-switch Nd:YAG, I have a high risk of having hypopigmentation like what we see right now. Yes, using fat, nano-fat may help, but it is not 100% sure. But when I have a little bottle with a product that is specific, it's easier, better, and safer for me. There is a hassle. I have to take nano-fat, means I have to do liposuction, take some fat out, collect it, filter it, and then use it. That will be a hassle in the clinic. And at the same time, I don't have a guarantee of anti-inflammation. And each and every one of us needs something that we know we can rely on. If I'm going to have a patient with necrosis or with a hypopigmentation or a risk of any complication, if I have a little small vial of a product which is a specific human growth factor that I know its job is to renew, I know that I'm going to have a safe result. So we need it, even as a godfather in the clinic. So if we have a risk of hypopigmentation or excessive inflammation that can lead to hyperpigmentation, we have to use this. Excessive growth of scars and keloids, we have to think of this as well. The next picture is about, I think, me. This is me in 2017 after my car accident. And this is the reason why I got into the science of growth factors. I am just like every other aesthetic doctor who only thought about, yes, I'm very grateful to all the doctors that stood by me, Dr. Zainuddin Obaji, who taught me about the skin and the skin science, which I love and I respect very much. I was always thinking about the cellular function. I always had in my mind that, yes, it's the cells that regulate our face. I agree completely. But there is a time when hydroquinone, TCA, glycolic, all of this will not be enough. We will have another problem. We'll treat one and get to another. Plus, after my car accident, I lost my job, and then so it was going to be very expensive to do treatment. I remember I met with Dr. Ahmed Qahtani, the professor who created this product, who is a doctor. He's not just a scientist. He is also a doctor, so feels what we feel in our clinic. I met him years ago, and he sends medical reps over to my clinic. And I had this little vial in the clinic, which I never used. So I thought to myself, I combined in my mind, I am going to, the next picture, use this, the next picture, to treat my scars. I am going to combine the two together. I am going to combine what I learned from Dr. Zain, chemical peels, skin regulating cellular function, with anti-inflammatory, because I might have a terrible risk of other things if I don't do so. And mind you, I had tried everything before. Psychologically, I was very, very traumatized, because you wake up and you look like a monster suddenly. You've lost your job and you don't know what to do. So this happened to me, so I feel it. So I said, okay, I will use this bottle and I will try it. I didn't use hydroquinone, so you can still see the freckles on my face. I used retinol and tretinoin to increase cellular turnover. Meaning when you use retinol makes the skin turn over faster. So it means I accelerate. I'm running faster. I used retinol and I used AQ recovery serum. As a chemical peel, I used retinol and I used recovery serum. And this is me after like a month in the next picture. And I want to say something. The reason why I am doing what I'm doing right now, I don't work for any company, and I said this last time. I say what I believe. And today I chose to come out again with no makeup. So if you look, I don't have foundation on my face at all. So I'm cleaning my forehead. I'm showing you. This is the scar in the old picture. This is my face. So I don't have, except some eyeliner, some lipstick, but I am not anymore like I was before. And this year, because of COVID, we were all depressed. I was not in the mood to do anything. So this is me doing nothing for a year. That's 2017, the accident happened, 18, 19, and this is me today. I didn't have to do anything. So I use myself as an example, because sometimes bad things happen to us and it teaches us to get out of the box. And I want to spread this to all of you. I want you all to know that there is another solution. The trauma that I experienced scarred my face. I didn't have the facilities to do all the treatments that could be done. So I started thinking out of the box. I started thinking what I could do with human growth factors, that has messengers, receptors. I started reading more about it. And then I improved myself. So how do we use AQ and growth factors? What is AQ and why? We can move to the next slide. I think I'm bored. I hope I'm not boring you all with my stories. Okay. First of all, when you're talking about AQ is patent. So I'm using something safe. I'm not using something that is made out of cactus or made out of rose. No, I'm human. I expect something that is approved, it's scientific. I don't believe a cactus is going to work on me because it's a cactus. We have different DNA. I'm human, it's a plant. So that's number one. Number two, it's approved, it's patented, so it's safe. We move to the next slide, please. And I want to say stem cells, PRP, growth factors, the difference between all of them. I don't even need to say anymore the difference between all of them, because it is not approved anymore, PRP. You don't do it on aesthetically on the face. It's not approved anymore by FDA. So if people actually really look into the FDA website, they will realize that PRP is canceled. Not because it's something bad, but because it's not specific. Today it will give you a result, tomorrow it will not. So it doesn't have a consistent result, so it's removed completely. So I don't even need to talk about that anymore. So things have improved. We have been saying PRP since 2017, and we have been saying it's not specific. I'm not saying it's bad, but it's not specific. Today I will have a result, tomorrow I won't. Why is it not specific? Because stem cells is not enough. It's growth factors. Stem cells are in growth factors. So you're talking about the father, not about the kids. So we move to the next one, the next slide. Understanding what are the healing and regulating properties. Understanding, going back again, the difference between proliferation and division. Proliferation means increasing in number. So when I have a wound, I want to increase the number of the healing tissues. Okay, I need more fibroblasts and blood supply to the area. So I know that when I use growth factors, it's going to help with proliferation. Division, differentiation, what does that mean? Change its function. It's going to do its function. it doesn't mean it's going to change into cancer. So we need to understand the words proliferation and differentiation, because growth factors have messages and receptors, and they're involved in renewal, multiplication, and there's also recycling. It's the normal anatomy of our body. So regulation means it's going to use some and throw away some. We need to keep this point in mind always. And knowing that healing, we're going to have inflammation for a few days, proliferation for a few days, and then remodeling. So we need to give time. Okay, so we go to the next slide, please. All right, this is an interesting case. This is a patient of mine who was in Bali, and she fell down and got hurt. And all I did for her was apply recovery serum growth factors on her leg. And in 10 days, or maybe probably less, this was the result. So the last picture up is her result. And she's a very tanned patient. There's a skin type 3 to 4, 4 to 5. And this was the result. No scarring, nothing. Just a little bit of hypopigmentation, but it will become normal in a few weeks. As doctors, we already know that. So this was her results. Finally, I came close in the last picture on top. You will see that this is her results in just 10 days. And I'm sure later on, because as you guys know, not all the time patients like to come back to take pictures. So this is the results that we got by just using AQ growth factors. And I remember I told her to put just a little bit, spread it on her leg every 8 hours. I actually wanted to tell her do this once a day, but I for psychological reasons, I told her to do it 2 times so that she will feel like she's doing something. But actually, you just need to apply it once and cover it, clean the area properly, nothing specific, and that's it. Clean, cover, and this is the results that you get. You don't wash, you don't let water come on it for a few days, for like 5-6 days, and then when you clean it, finally, this is the results that you get. So scarring, like this, you have prevented scarring. So you don't wait for the scar to start to happen and then you say, I'm going to use AQ. Then you will need AQ with other devices or other chemicals. But when you have it fresh, if you use AQ directly, you will get the results. You will get a good result. So fresh wound is different from old wounds or old scars. So the next slide, please. And as I said, you can combine lasers, radio frequency, and chemical peels. RF is very good for stimulation of collagen and elastin. So if you've got a deep scar, which is like a hole, like an acne scar, radio frequency is very nice, in my opinion, for that. Chemical peels also are very good. CO2 is very good for all kinds of types, CO2 resurfacing lasers. So all of this is good. It depends on you as a doctor. Which car do you know how to drive? All cars are going to take you to whatever destination that you want. Just that one is faster than the other. So it depends on the patient's capability or finances. So it's all up to you. A Ferrari is like a Fiat, is like a Hyundai. They're all the same. They're all going to take you to the same place. One is just faster than the other. So you drive the car and you tell your patient what you need to do. So next. Watch out for fake products. Yeah, we've all been saying this for a very long time. Make sure your sources are known. Make sure there's a lot of research. And don't believe anything until you have actually, I'm not going to say try it on yourself. I try everything on myself, but listen, read, see the experience about people, because the fake products that are in the market in the next picture can cause us a very big problem. When I started my career, somebody told me, Joanne, one mistake, you will lose 20 patients. One good thing, you will gain 50 patients. One mistake, you will lose everything. So we are not going to go cheap even though we are in a very bad situation financially, all of us, we rather don't do it. Just refuse to do it. So don't hurt anybody. Just don't do it. If you're not sure about it, say no. If you know that there is something else which is more expensive, just do. I said there's something else, it's more expensive, but I can't have it. I will not do anything fake no matter what. The next slide. All right, fake things can cause a lot of problems. And if we've got one patient and this happens with social media and WhatsApp and everything, 1 second they will spread the news everywhere and then you will lose a lot of clients. So it's better to be safe than sorry. I will not put myself in this situation. I rather not do it. I think to myself, how much am I going to gain from this client? I rather not have it and have peace of mind. So I am not a coward, I'm just safe. Next picture, please. And by the way, when she used recovery serum, she became healed. She became better, but it took a long time. It took a long time to get to this. So let's not put ourselves through this further. You understand what I mean? So let's not get there, because imagine how much you're going to have to spend to treat her. The spread of lies. So this is lovely, because I don't know over there, but in the Middle East, anybody that texts anything on social media, bloggers, influencers, it's terrible. And there is this disease now, I think we need to add it, which is the filter disease, like all the filters. People come to you with filters. I want my face to look like this filter. And I'm like, this is impossible. You need a magician. So you have to tell your patients that I'm not a magician, I'm a doctor. Okay, I cannot do miracles. So, and there's a disease. People are sitting home, depressed, doing nothing because of the situation. So they are like looking for little small things, and all these filters are making people get crazy. It's not true. So we need to educate our patient. This is impossible. This is not realistic. This is not human. And also, not everything you read on Instagram is true, or sorry to say, on any social thing is true. So we need to educate our patients. It's our job. Next slide, please. Okay. So how do we use AQ growth factor? Next slide. All right. We have many ways we can do it. The simple, easy way, which is by using the dermal stamp. Why do I say I prefer our dermal roll? Why didn't I say needling? Because there's, as I said, the growth factors are messengers that have receptors. There's a depth for that. If you go very deep, the receptors are thrown, they've gone away. You have put them in the wrong place. So there's a certain depth which is very minimal. You don't have to be bleeding, because that is where the blood vessels are when you're superficial. So stay in the superficial plane as indicated. Inject in the right plane. Going very deep doesn't do the job. So it's not like, oh, going very deep. No, you will just lose the product, or you will cause another problem. Okay, you will increase inflammation. We induce inflammation that is controlled, but we don't want to cause uncontrolled inflammation. So we just apply a little amount all over the face according to the surface area that we're treating. I do not specify using 0.5 or 0.1. I use according to what I see in front of me. So I do not use on this on patient's face 0.5 and on the neck 0.10. No. According to each patient differently, because some people are wider, thinner, so it differs. So it's a very easy procedure to do if you're just doing it for rejuvenation. Now, in the Middle East and in Asia, it's different. So the next slide is going to show you the protocol that I do. I do not use AQ or any growth factor, and I only use AQ, by the way, alone. Meaning, our skin is oily. We have rosacea due to our climate, due to our hormones, hereditary, everything, sugar consumption, all of this thing, our lifestyle. So we have oily face. If we put Imagine we have a frying pan, we're frying potatoes, we throw the oil away. If I put a bottle of water in a pan with oil, it will not absorb. The oil will act as a buffer. So I need to clear that oil first to clean it before. What do? I clean it. There are many devices for cleaning, hydrofacials and but these are all expensive. For me in the Middle East, just getting a little bottle of salicylic acid, which I like. Why salicylic acid? Because salicylic acid job, function, is to regulate the oil glands. So it works on the oil glands. So as I use growth factor, I think my messengers, where they go, the same thing. Salicylic acid, where does it go? It works on the oil glands, make it shrink, clears the oil. So I don't use alcohol. I use salicylic acid, 1 pass. So the next slide will show that I use salicylic acid 15%. I'm telling you all 15% because it's safe, but usually sometimes I use higher. So the next slide will show you a small protocol that I have written, which is very easy. 1 or 2 passes of salicylic acid, water-based, not oil-based, not petroleum jelly-based, water. So it's liquid and it costs nothing. You apply 1 or 2 passes, it does like a whitish powder effect. We wait a little bit for that to settle. And then I don't clean, I use the Derma stamp or the Derma roll, and then I apply a little bit of AQ recovery serum if I'm talking about the face, even on the hair. Anywhere else. On the hair, if it's oily, I will put salicylic acid on the hair, or even glycolic acid. A little, not a strong amount, to make sure I or whatever. So the same thing if I'm treating a scar on the body or on the face. I will remove the oil first. I use always salicylic acid before I use AQ, because some people complain, I used AQ and I got more acne, because you put oil with oil. So oil with oil, inflammation with inflammation, you get more. So we clean the place first before we apply. So this is what I do. It is not with the company, but this is what I personally do, because everyone keep asking me. So I want everyone to keep this in mind. Okay, and when you put salicylic acid, you don't put it like this. You really rub it in, especially if you've got thick skin, okay, and if you've got ingrown hair. So we move to the next slide, please. These are some few pictures that Unison, Dr. Jennifer were kind enough to share, so that I can share with you, because I don't have consent to post in the Middle East. It's quite difficult for ladies to accept their pictures to be posted. So the few next slides, please, you can move on. The next slides will show how it works on inflammation. So here we don't have acne. We have eliminated the acne using salicylic acid. In my clinic, when I have a patient like this, I use salicylic acid, and then I use the recovery serum for 5 days, and then I give a home care routine. So you use AQ recovery for a few days, and then I use the home care routine, which is growth factor. And I start thinking, I'm using growth factor for inflammation. What am I going to use to treat the acne? Salicylic acid, retinoic acid, whatever for pigmentation, hydroquinone. I combine them all together. And at the same time, once the inflammation and the acne has stopped coming out like before, I start treating the scars with laser, CO2 if it's acne scars. And I also do a chemical peel, and I apply recovery serum. So I hope you're not getting confused and you understand me. And this is exactly what I do to the scars on my face. Why? I have caused wound, which is the inflammatory phase. I have allowed remodeling to happen, and then I want to increase the renewal, which is the proliferation. So I use something to accelerate. So I use retinol or tretinoin for both scars and acne. Why do I use the same treatment for the 3 problems, for scars and acne? and for pigmentation? Simple. It's because we are regulating cellular function. We are regulating cellular function. When we regulate the cellular function, we will treat all the disease. So if you've got acne, it is from inflammation. Overscarring is because of the inflammation. If it is melasma, it is the inflammation. So when I regulate the cells, I tell the cells not to hypopigment, not to hyperproduce. I have controlled everything. So controlling, regulating is the treatment. Next slide. Okay, and we can keep going. So these are just pictures from Unison. Thank you very much for these pictures, Dr. Jennifer. So the next pictures are all, you can, okay, keep moving them. And please, if you've got any questions, because right now you're just going to see pictures, and I have publications of papers about doing a lot of trials on 38-year-old women who have gone through AQ, human growth factors, and how significantly they have improved. So many publications in many journals are available. You can keep moving, please. So before and after 6 months, because acne, you cannot treat it in 1 month. You need 6 to 8 months. So these are lots of publications, papers, 2000, February 15, showing you growth factor that is induced therapy for skin rejuvenation and renewal. So rejuvenation, renewal means regulation of cellular functions. The next slide will show studies, highlights on studies that are done with AQ on women of Asian, Caucasian, Latinos, because we have the most complex skin types, and anything can cause a hyper or hypopigmentation or over scarring. Okay, and I'm ready to take any questions from any of you. Can move to the next slide, because these are studies done, and if you want to go back, you will just see in the conclusion the studies has revealed improvement, almost 95% more self-confidence. Once you have started seeing an improvement, you will want to do more. So you can go ahead and read more about it, and I'm here to answer questions. I hope I didn't bore you so much. So, Dr. Santi.
Okay. Yeah. Thank you very much, Dr. John Haddad. We already have questions in the question box. The first question is from Dr. Ayuni. Hi, Dr. John. Which one is better, using the platelet-rich plasma compared to using the synthetic growth factor? Please, Dr. John Haddad. So compare PRP and the growth factor.
Okay, PRP doesn't have messengers, specific messengers or modulators telling it what to do. Growth factor is the father. Inside growth factor, you have stem cells, okay? But they're not specific. It's growth factors that are responsible for division, proliferation, fibroblast renewal. So if you use PRP or platelet-rich plasma, it doesn't have specific modulators telling to go and do wound healing, go and do decrease the production of melanin. It doesn't regulate the cellular function. It's not specific. It just goes. It may do it. It may not, because it doesn't have messengers telling it your job today is to go and regulate cellular functions. It's one of its many jobs. So it could be gone as waste, recycled, or it could do something. So you don't have consistent result. A patient will come today, will do it, she'll be happy, and then the next day she'll be, the next time she does it after a month or so, she will not get the same results. She will say, last time was better. She will blame you. Even though you didn't do anything wrong, but because the pre-RP is not specific. So that is where you did wrong.
Okay. Okay. And then the next question. This one is from Dr. Grace Lia. Hi, Dr. John. I usually use Dermapen and then follow by giving the AQ solution. And then 2 until 3 days after the treatment, there is starting to have acne new acne in their face, mean new acne. What do you think about this case of patient? And this Dr. Grace asked, is it better to use platelet-rich plasma for this case? Please, Dr.
It,
Joan.
it will happen. It will also happen. It will also happen. The difference that the platelet-rich plasma is when you divide it, it's liquid. So when you put liquid on an oily skin, it's going to be absorbed. So it will not improve the skin, but it will not cause acne. But it will not do nothing. This is why I said what I just said now, which is we have oily skin. The recovery serum is an oily base. If I put oil on oil, it will cause more inflammation. So we need to eliminate the oil. So please, doctor, I want you to try doing 1 or 2 passes of salicylic acid, 15% or 20%, and then the dermapen, and then apply a little bit of the recovery serum. And then after you do that, see the results within 5 days. Now, after 5 days, what happens? When you have finished the inflammation, you're coming to the proliferative phase. What does proliferation mean? The skin is starting to act up. What do I do? It's starting to retaliate. It's like a naughty boy. When my kid is bad, I punish them. The first time I punish them, I say sit in the naughty corner, they will retaliate. I would have to punish them again and again. So meaning during this retaliation phase, I start to treat the problem. So if she came to me she has acne or her skin is oily, it means she's got inflammation deep there. So starting on the day number 5, which is, as I showed you, the day which is after inflammation, proliferation phase, we start giving the medication. We start giving tretinoin to apply on the face. So now we are controlling. And then the remodeling phase, which is after 14 days, I see the good skin. So I cannot hang everything on AQ. AQ is anti-inflammatory, regulating the cellular function, but it's not going to treat acne and oily skin. So I have to eliminate the oil to clean the face first with salicylic acid, apply, and then during the remodeling phase, I use tretinoin if I've got acne.
Okay. Okay. And then we come to the next question. This one is from Dr. Maria Angelina. She wants you to explain what is the contraindication cases which we cannot do growth factor. For instance, for a patient with keloid tendency to get keloid, is it contraindication for the AQ?
I haven't read anything contraindicating AQ for anything. It's just when you've got keloid, you just need to know how deep you should go. You shouldn't go so deep. You shouldn't use lasers, maybe. It depends on what protocol they use. When I have a keloid, I only use chemical peels like TCA and stuff, but after I condition the skin, I pre-condition the skin first for like 6 to 8 weeks with hydroquinone and tretinoin to help cellular proliferation. And then I do a chemical peel. I don't use the dermapen. I don't use any needling. I just do a chemical peel, TCA 15%, after salicylic acid. Salicylic acid first, 1 pass, and then TCA 1 pass. And then I put the recovery serum without needling, without poking. I get a good result and safe result. And sometimes I go under the scar. I do a little bit of subcision, a bit of corticosteroids. I use the traditional way as well, but I do a chemical peel, so I'm working from down and from up, and I put the recovery to make sure I decrease inflammation, because when you're in the remodeling phase, sometimes you get more and more skin growth, fibroblast just goes crazy. But when I use AQ that is regulated, use receptors that tell you when to start and when to stop, I am safe. So this is why also I like using something safe, so it doesn't get worse.
Yes, thank you. There is another question. This one is from Dr. Megawati. Besides applying the AQ with microneedling, can we inject the synthetic growth factors intradermal? What do you think, Dr. Joan?
This product is made in a certain way that doesn't need to be injected deep. When you inject deep, what are you going to do? What are you going to gain if you're intradermally. What is there intradermally? You're in the epidermis. You're in the places where the cell is. You just want to regulate the cell. You don't need to go deep. So you're just superficial where the cells are. You don't need to go to the neighbors. You just need to go to the people you're visiting. You don't need to go down. It's a waste of product. You just cause problems. You're injecting the wrong thing in the wrong place. So no need.
Okay.
Your cells are up, not down.
Okay, thank you. Okay, to all the audience, is there any other questions? I'm still waiting. If there's any other questions for Dr. John Haddad, okay, it's all okay. All has been discussed. Yeah, Dr. John, I'd like to ask, what about if we have patients with decubitus? So someone who lies down for a long time, so and on the back area, and she got decubitus, it gets some scar. What do you think? Can we apply the AQ for these cases?
Actually, AQ recovery serum especially started on, they were using it on diabetic foot. So,
Diabetic. Okay.
of course, in wound healing, because it's all about wound healing, regulation, and regeneration. And
Okay.
it's all about getting everything back to normal, making the cells work normally. So, of course, because it is inflammation. So, definitely, of course, you can use it.
Okay. We've got one question again. This is asking about stretch mark. Can the AQ or growth factor repair for problem of stretch mark?
Oh yes, actually I'm seeing a lot of very good results with stretch marks.
Okay.
Definitely, but using a derma stamp.
So,
using a derma stamp, applying recovery serum, but not injecting it into the spread, because some people do the mistake of injecting under. And when you do that, you're just going to cause an infection because it's dead already. You're just trying to, it's dead collagen. So you're trying to wake it up. So you don't, if you go with a needle, you're going to lose the area. You're not going to go epidermis, you're going to go deep, just like the question before. So you're going to lose the product. So no, and you're injecting some oily substance under the skin.
okay.
No. But I have a way of doing it now. What I do with stretch marks, I do both. So if today I'm going to give an advice, something new, I am working with a lot of fat.
Okay.
Growth factors have made me eat, sleep, think, dream fast of where I can get growth factors from. So I'm thinking with AQ, I can work superficially. How can I work deep? Let me give it a try. Let me take adipose fat, fat from our under the skin. Okay, so dermal fat grafting, so removing fat under the, you don't need to be a surgeon to do it. An aesthetic doctor can do it. We take some fat. I do not nano the fat, means I don't break it so much, because emulsified fat is not really a very good idea. At the same time, putting fat on it as it is, also it's going to augment the area. So I kind of go midway. And I use a cannula, a thin gauge. I go under the stretch mark or the scar, okay? And I subside with a blunt cannula because it would be too painful. I subside. I don't use a lot of lidocaine because when you use a lot of lidocaine, it kills the growth factors and the stromal vascular fraction. So I go, I inject deep. So I kind of lift the tissue upwards. If it is a depressed scar, like in stretch marks, they're a bit depressed. I inject very little, leaner coming out. So it's not fat, and it's not emulsified, it's in between. After I do that, I will do 1 pass of salicylic acid on the surface of the skin and a little bit of a dermal stamp, and I apply the recovery serum and I cover it with a gauze, with a dressing, okay? And I tell the patient to keep it for 3 days, not to open it, not to let water come out. I see beautiful improvement, beautiful.
Okay.
On scars, because like yesterday I had a patient who had a knee surgery done a few years ago, and I couldn't take a video, you know, it's in the Middle East is not beautiful results. We did a session 3-4 months ago, and we did another one now. Why am I saying 3-4 months ago? I give time for skin and collagen to renew itself. I'm not doing one session every month. That is regarding the fat. But every month I was doing Dermapen for her. Dermapen with AQ. But the fat was done once, 4 months in between.
Okay. Yes.
So that's
Another
my
question.
advice to everybody. Start thinking about fat because
Yeah.
the economical situation is hard. One syringe of filler or it's expensive.
Yes.
Skin boosters are expensive.
Uh-huh.
You can make your own skin boosters at home now. In your
Yes.
and not at home, I mean in the clinic.
Yeah, of
Now,
course,
we as doctors
nowadays.
can
Mm-hmm.
make nanofat, oxysulfide. That is the best skin boosters, and we apply recovery serum. So we are working deep and superficial. I am injecting deep my skin booster as growth factors, as fat or nanofat, and I'm applying superficially growth factors as AQ. So I'm working as a combination, 2 in 1.
Okay. Yes. Another questions. We've got two other questions. First is from Dr. Maya. What about can we combine PRP with growth factor and apply it with Dermapen? So this question about combining with Dermapen and applying AQ and
No,
PRP cannot. Okay.
no,
Okay.
cannot. There is no need.
Yes. Okay. Another question. This is
You
about
can do
alopecia.
the psychology of the patient. Take the blood and tell the patient, "Oh, we are going to do a combo," but don't do it.
Oh,
Okay.
okay.
Some
Okay.
patients psychologically they
Yes.
feel good when they take out blood. So just do the act. Oh, yes, we're going to do this. You have to work on the psychology of the patient. That
Okay.
doesn't mean you're a bad doctor. You're not lying. Okay,
Okay.
the patient is not telling you what to do. You're just okay to make her feel better. Okay, we take some blood, but we throw it away. Okay.
Yes.
We don't
Okay.
combine.
Yeah. We still have another question. This is about alopecia. Can the AQ work for a case of alopecia, and what kind of alopecia will get best result with applying AQ?
First of all, with alopecia, I like to do subcutaneous corticosteroids.
Mhm.
First of all, every 4 or 6 weeks. And then after I do that and I see that it's no more spreading, then I start using recovery, the hair complex. Or for alopecia, if it's on the hair, on the scalp, I use the hair complex. It's on the face, I use the recovery. How much improvement do I see? Again, the hair cycle, we have the anaphase and all the phases of the hair. Because we've been using like treatments like Propacia, minoxidil, and all of these things, it kept us on the anaphase for a very long time. So it kind of disrupted the normal cellular turnover. So even if you get hair growing, it's thin and it's fragile. And if you stop, the hair falls back because you start all over again from the beginning. So what what growth factors does here is regulate the cellular function. So it is going to take time, which is the normal cycle, which can be up to 1 year for the hair to come back. So it's regulating the cellular function. So if your eyelashes need 21 days to be renewed, or your eyebrows need 90 days, you have to know if it's on the beard, how many days is it going to be, if it's on the hair. So you need to add it up. But yes, it does work. But first of all, if there's inflammation, treat the inflammation. Start with subcutaneous corticosteroid, a little amount every 4 to 6 weeks. Usually you need 2 sessions of injecting corticosteroids only, and then you start with the recovery is on the skin, and on the hair is the hair complex. Don't use the substances for the face on the hair because, as I said, growth factors are messengers. These messengers have receptors. This
Yeah.
receptor for the skin is different from the one of the hair because the cells here are different, or a different layer than the one here. So we have to
Okay.
work accordingly.
Okay, so we have to use the specific type, which one is for the alopecia, which one is for the skin on the
Yes.
face. Okay,
One is
I
for
think
skin, one is
this
for
is, yeah,
for the vagina, because everyone has messengers, modulators
yep,
telling this growth factor go and do this, go and work on the skin, go and work on the knee, work on the hair. So you cannot put the hair messenger in the face. it will not know what it's doing. It's like doing normal PRP. So you're doing just the wrong thing. But
Okay.
first, eliminate oil. Please eliminate all the oil with salicylic acid.
Okay, I think this is the end of the question because we are running out of time. Thank you very much, Dr. Joan Haddad.
I want to
Yeah.
say a special thank you to Unison, Dr. Jennifer, Mr. Raymond. Thank you all. Dr. Ahmed Kahli, Dr. Santi, I miss you. I miss all of you in ISWAN. And I don't want to say names and not say the others. My regards to all of you. Big kisses from Cairo, from Lebanon. And I hope I see you all again. Thank you so much.
Yes. Thank you, Dr. Joan Haddad. Stay safe, stay healthy, and success always for Dr. Joan Haddad. Okay, thank you very much. Yeah. Before we close this session, this is the end of the session of virtual ISWAM 5th January 2021. Before I close this session, I would like to inform everybody to follow the next topic. The next topic and the next schedule is on the 7th of January. Don't forget the time. Join us again at 7th of January for the next session of Virtual ISWAM. And then before we close the session, I would like also to inform that Perdesti Global Medicom now has spreading the business in beauty pageant. So we call it the Miss Global. In Indonesia, we already have the Miss Global of Indonesia, and the event was held last year in 2020. We already selected from 60 beautiful ladies from all Indonesian, and we already have our queen, that is Miss Olivia Atten, and next year, Miss Global Indonesia will compete with other ladies from other countries in Miss Global International. And what is special, next year, Indonesia will be the host country for Miss Global. So we would like to have all of you, doctors or participants, please give us support. If you have any suggestion or anything, please contact us in ISWAM. We will prepare everything for the next year event in Indonesia. Miss Global International and Indonesia become the host country. Thank you very much for all your support. And this is the end of the session today. Thank you very much to all speakers, Dr. John Haddad, Dr. Anna Kaleba. We have a nice talk for this afternoon. Hope everybody stay safe, stay healthy. See you all next time. Bye-bye. Okay.